woke up one morning with just severe vertigo, and I called my primary care doctor, and I went in there, and he thought it might be an acoustic neuroma, so he sent me for an MRI, and lo and behold, it was an acoustic neuroma.
An acoustic neuroma is a benign tumor of the 8th cranial nerve. If you think of a power cord in your garage, it's got the copper wire in the middle and the plastic stuff on the outside. So an acoustic neuroma is a problem in the plastic of the power cord. The first symptoms that patients have are hearing loss and ringing in the ear. And then sometimes, although it's unusual, they actually have dizziness.
I had to have somebody help me walk. I was nauseous all the time. And it just happened that my husband had met somebody that knew Dr. Wyatt's father, who had retired, suggested I go see Dr. Wyatt. My frustration with my first doctor, he said to me, yes, you have profound dizziness, but we don't think that the acoustic neuroma is causing this. Now you're a female and you're perimenopausal, so we think, you may be having silent migraines. Then he was going to give me this injection in my ear to kill the nerve. And it was the same day I was supposed to have it done, I got the appointment with Dr. Wyatt. You talk about, a godlike moment. And I saw Dr. Wyatt, and he literally looked me in the eye and said, I believe you. It was a small acoustic neuroma, but he said those little guys cause a lot of trouble.
So you want to make sure that you've covered all your bases and that there's nothing else that could be possibly causing their dizziness. And we're coming up at a dead end. So basically I told her that, I believed that it could be a cause of her dizziness.
And when I was saying, I'm on the couch and I can't live like this, he goes, you don't have to anymore. I'll help you. He sent me to go see Dr. Byrne, and Dr. Byrne looked me in the eye and said, I believe you.
So she was forced to make a decision in regard to the management of this problem, and she chose surgery. While this is considered brain surgery, we're not actually operating on the brain. We take out a tumor that is right near the brain or compressing the brain because of its location.
We set up the surgery date, and this whole team surrounded me, and I woke up, and you know what? There was no dizziness, and there was no nausea. And I felt like I was their only patient, which I know I'm not. But I felt like when I was there, I was their only patient, which is what you can only dream of with a doctor and a team like that. I said, I don't think you truly understand how you gave me my life back. And he looked at me, he goes, I am so glad. Look, I'm gonna cry. Yeah, it's an awesome journey. It's off the path, I'm very passionate about Rush and its care, and I was talking to somebody that I know who was going through some medical issues, and they were deciding on where to go, and they brought up Rush. I'm like, you have to go to Rush.
That's why we do our job. Those are the types of things that drive us as physicians, to help patients like that.